Kia ora koutou. Welcome to our June webinar, which is all around AI scribes, particularly around a scribe called Heidi, which I'm sure many of you have heard of. And if you haven't, you're probably living under a little bit of a rock. So tonight we're going to give you all of the ins and outs, what you need to know about Heidi, how to use it, all the tips and tricks. We're even going to give you some really big inside information around how you can change the settings to be a little bit more applicable to you. And then we're going to actually open up our Q&A for you to be able to ask all of the questions that you have about Heidi, and our expert panel is going to be able to answer most of those questions and hopefully be able to provide you with some really good information around Heidi and how to use it effectively in your practice. So for those that don't know me, I'm Jess Morgan-French. I'm the CEO of Collaborative Aotearoa, and I'm super passionate about things that we can do in primary care that enable us to be a little bit more efficient, a little bit more effective, but deliver really good quality care to the people that come and see us every day. So our whānau that come in the doors that need to be able to see us. And this is a tool that I do truly believe has enabled us to provide a little bit more whānau-centred care to the people that we are serving, plus also give us a little bit of a break in that admin space, because we do have very heavy admin jobs in the primary care world, and this has kind of taken some of that admin load off us all. I'm going to open us up with karakia, and then we're going to, I'm going to introduce you to our beautiful panel, and then we'll get started right into our webinar tonight. Me mahi tahi mātou ka kōrero ka whakaronga kia atawhai kia manaaki mōna whānau me te hapori katoa. Kia rātou te tino rangatiratanga I o rātou haura, kia pai te taha tinana, te taha wairua, te taha whānau me te taha hinenaro hoki. Haumi e, hui e, tai ki. Beautiful to be spending Monday evening following Matariki with you all. What a way to start your Māori New Year with us at the Collaborative and with Flo and Kalolo, our friends at Hendrix Health. So I'm going to hand over to Flo and Kalolo to introduce themselves, introduce Hendrix Health, who we are super lucky in New Zealand to have an organisation like Hendrix Health to help us with all of these tricky AI Heidi Health things, and help us navigate through what can be a really difficult change process, but make it really simple and easy. And the best thing about Flo and Kalolo is they turn like really technical stuff into language that we can all understand. So I think they've got a few superpowers between them, and we're really excited to be able to share with you a bit of the roadshow that they've been up to. They've been creating some waves across the country, visiting all of the little places, even those on the West Coast, going in and having a little bit of a tutu with Heidi Health and the technology that we've got in that space, and be able to show you the magic that it can create if you are using it safely, you're using it well, and you're using with really good intentions. So over to you, Flo and Kalolo. I'm looking forward to hearing about what you did on your roadshow, but also bringing the roadshow to those of us that couldn't get to the roadshow. So kia ora, welcome to the webinar.
Kia ora, Jess. Thank you so much for that beautiful kōrero, and thank you everybody for giving up your Monday evening to spend with us. I'm so pleased to be here. For those of you who haven't met us before, my name is Flo. I'm one of the co-founders of Hendrix Health, which I founded with my brother from another mother over here, Kalolo, or Kalo, like J-Lo, as he sometimes prefers. And yeah, I'm really excited to share more about our road trip, everything we've learned along the way, and yeah, share everything about Heidi with you today. So please ask any questions in the chat. We love questions. We typically run over, so we're going to try not to do that today. I'm going to pass it over to Kalolo to introduce himself.
Malo lelei, talawhalawa, kia ora koutou katoa, ko ai au, ko kaloloha whānau tōku ingoa. And yes, I am the other half to the co-foundership to Hendrix Health, and it's a pleasure. It's a pleasure to be here and to be able to reflect and share with you insights as we've gone kanohi ki te kanohi all over the motu, talking to many of those in our primary care health system. So it's absolute pleasure to be here and to share some of those learnings and to share with you as well some of the snapshot of the things that we've been showing in our evening sessions throughout the country. Without further ado, what I'm going to do, e te whānau, is I'm going to go ahead and share my slides. So I want to start off with a whakatauki. Whaia te ki iti kahurangi ki te tuahu koe me he maunga teite. Seek the treasure you value most dearly. If you bow your head, let it be a lofty mountain. Before we get into our presentation, it only makes sense to start off with the spirit of this whakatauki, because one of the reflections that we've had is, as we've traveled around, being able to learn an AI scribe tool has been in many ways a mountain for people to be able to go through the obstacles of learning and educating themselves on how to use this tool safely, ethically, and not at the detriment of patients. So I bring that spirit in, knowing that we can climb and hit the top of that maunga and to find that treasure, and that is being able to maximize the use of an AI scribe tool like Heidi. So I'll pass time over to Flo.
Yeah, well, obviously, Heidi, Hendrix, how do they fit together? That's obviously something we want to share with you. So Heidi was founded in 2021 in Australia by 3 co-founders, with the main co-founder, Dr. Tom Kelly, being a surgeon at the Alfred Hospital for many years. It's a tool that we at Hendrix Health have come across firstly in probably in August last year. We've been on our journey for about a year, and Hendrix Health is actually named after my son, Leo Hendrix, and Kalulu's godson. And we're using him as a bit of an avatar, because really the purpose behind Hendrix Health is we want to ensure that by the time that Leo is a teenager, we've still got a bit of a healthcare system left, or ideally a better healthcare system for everyone in New Zealand. And so we really started on a journey, really focusing more on the problems, and we quickly learned, traveling throughout the country in August 2024, visiting over 100 GP clinics, 10 Haora Māori providers, 9 Pacifica providers, that if you live in a place like Oamaru, you can't enroll in a GP because no books are open, and you're going to have to take the bus down to Dunedin. Unfortunately, there's no bus, so that's a problem. And we quickly, we really started the company with that sort of problem focus, because a lot of our friends and whānau were in the same position, waiting for a long time to get to see a GP, or were stuck on some kind of waiting list at Te Whataora. And so while we went on that trip, we learned that there's a few things that are not going in the right direction. Obviously, half of our GP workforce is set to retire by 2032. Obviously, well deserved, but a bit of a problem for the rest of us. And half our hospital workforce is thinking about potentially moving to Australia, which is something that we also can't let happen. So we quickly then learned that there are a few tools out there, AI scribing tools, that were making a big difference to clinicians, reducing that cognitive burden, bringing the joy back into your work, and also helping you to save time and focus more on patients. And so we actually thought that was amazing, and started advocating on behalf of these tools, and helping organizations adopt these tools for free for many months. And time and time again, people told us, well, I used to use X, but now I use Heidi. And we got very interested in that, and eventually decided to break bread with the Heidi team over in Australia. And since December, we are now the official New Zealand Heidi partners. And we have been very busy over the past 6 months, implementing thousands of clinicians across hundreds of organizations in general practice, in hospices, in the hospital, vets, for psychologists, allied health professionals, really in all kind of walks of life. And it's been really an amazing journey. And if you want to share the next slide, Kalolo. Recently, we've been traveling the motu. There's a few nice pictures there from our trip. But yes, like Jess said, we decided to hit the small places first, because that's where where all the action is in New Zealand. We're certainly not done. We do want to go up to the far north. We know that we haven't been to Tauranga, we haven't been to Wellington, we haven't even done Auckland yet. But we decided to start in actually in Hamilton of all places. I had a beautiful day there at the Whale Pacifica, which was an amazing evening. Then went down to New Plymouth. Then a couple of days at the amazing collaborative Aotearoa conference. Big shout out to Jess and the collab team. That was amazing. Had a beautiful time staying on the marae as well. And then up to Palmy and Rotorua. Rotorua, very special as well. We're just kicking off, or we have kicked off a big pilot there with 80 clinicians with the support of the RAFs team, which is amazing. It's one of the biggest ones we've done so far. Also in the Hawke's Bay, we implemented a hospice over there, and we also spend 2 days implementing a big pilot with Health Hawke's Bay across 50 GPs and 12 practices there. And then the South Island, we actually started on the very bottom. Originally, we were going to do Queenstown, but then we got convinced by the Wealth South team that we got to go to Invercargill, and we're so glad we did. Had a great time down there. Went to Dunedin, implemented an urgent care clinic, the largest one in Christchurch, on the morning of the Wednesday, and decided that we didn't need a rest day on the Thursday after all, because there was that offer to go to the West Coast, and oh my God, it was a beautiful trip across Arthur's Pass. Had an incredible night there, classic Kiwi banter, and yeah, just learned so much along the way on every step. So what did we learn? If you want to go to the next slide, I think for us, and please Kalora chime in here, I think it was really nothing better than connecting with humans on that human level, really listening and understanding where everyone's coming from, what maybe some of the challenges are, why people have adopted it or not adopted it, what's holding people back, how can we help everyone sort of take at least a small step on their journey towards hopefully a better way of doing things, but we acknowledge it is a different way of doing things, and there are definitely reasons why you could be hesitant. And so it was good to understand all of these things, and nothing really replaces that human connection. Any thoughts on that one, Kalolo?
Yeah, I totally agree with you. It's quite interesting that we tend to leverage off technology, especially after the COVID period, where a lot of people had to maximize on digital technology. However, I tend to see, like, now that we're past the phase of what we've gone through a couple of years ago, there's more of a need. In fact, time and time again, we get comments from people face to face saying, thank you for coming and seeing us, because this means a lot. And I think there's power in that type of kōrero and that hononga, that connection. So pretty powerful to actually be there face to face rather than just being on an online session.
Not talking down this webinar at all, Kalala, but it's definitely it's beautiful. We enjoy it. That's the way that that we like to do things, is to be there if we can. Obviously, we can't always be with you, and it's great that you're joining us from every part of the motu tonight. But yeah, I think the second insight is that we've heard so many different stories of kind of the impact that a tool like Heidi can make. Other AI scribing tools has made in their lives, but typically it's Heidi. We've recently implemented a GP clinic, and we had 4 GPs independently tell us, unprompted, that they're now not looking to retire, which they were thinking about doing in the very near future. And that's exactly the kind of thing that that I think is really, really powerful. It just speaks to the fact that it helps you to do things that you actually enjoy doing, like looking after your patients and whānau, rather than all the documentation burden and sort of having to worry about that after you come home, doing unpaid overtime. I don't know, maybe doing your laundry at the same time as you're doing your documentation. It's it's really powerful. Kalua, you want to say something to that?
Yeah, I think the two things that really come to mind. The first one is where most of us, by default would say that it does save time. In fact, it does save time. But I always say that time is one of the most precious things that we have in this life. We can make so many things, but you can't make back time. So it definitely does save time, especially after hours time. Similar to what Florian had said around, often we get clinicians who are saying that while they're putting laundry in for their tamariki after school, they're working on their notes, right? So there's a lot of significant reduction there. But the biggest one for me has been the cognitive load on a clinician, right? I think that's the biggest one that I've seen. Workplace satisfaction from our indicative research from multiple pilots has shown massive increase in workplace satisfaction, and also the cognitive load that reduces. However, one thing I do know is with that cognitive load that has reduced because of administration burden, because they're saving time in consultations, they tend to spend more of that time from what I've seen on educating the patient. Because they have that time and that space to do that. So yeah, just wanted to add more thoughts around the changing of lives there, Flo.
Yeah. And then the final point is that now that we've sort of started focusing on what happens after we've done the initial training, what happens after people start using Heidi for some time. I think everyone's that uses Heidi is very familiar with what a great tool it can be for note taking, but it's actually now through the projects that we're doing around continuous improvement, we are really, really interested and excited by all the other use cases for Heidi. So really anything what you're currently, creating an email, you're creating some kind of letter, you're updating a document in an electronic system, you're having some kind of meeting, that can all be done. So for example, with a hospice, they're doing a multidisciplinary team meeting once a day where they do the handover from the night shift to the day shift, and building out those meeting templates and seeing how they overcome some of the challenges around talking about multiple patients within one clinic, which is not typically done in Heidi. Typically, you've got one patient, and how they use the context to do that. That's really empowering. We had a clinician in the Hawke's Bay who used to always write a sticky note and put on there, like, this is what's wrong with you, this is any medication changes, the plan, and then here's the safety netting. He didn't call it safety net. It's just like, here are the things that you should expect. You got a cough. You're going to cough. Don't come back to see me if you cough, because you're going to cough. But if this happens, then that's something to worry about, and then you can come back and talk to me, or here's how you get help. So those kind of things, we can automate them, and those are just there's so many examples of that, whether that's a time off work note, a wins note, all these kind of other workflows, and some of which obviously Kalora will show you in just a few minutes. Yeah. Now, shall we move on, or do you got something to add to that, Kalora?
Yeah, I just want to acknowledge, Jess, we've had a lot of great, robust discussions around workflows. I often say, and I leverage off a quote by James Clear by Atomic Habits, you don't rise to the level of your goals, you fall to the level of your systems. And systems here are workflows. And when we talk about templates on Heidi, templates equals workflows for us. So this is a time for us we now have a powerful tool like this. How do we reimagine our workflows to ensure that we're there better for our patients? And one of the big points that I've seen now that's moving quite fast is, how do we capture more and encapsulate in a medical notes the social side of things? Te whare tapawha under impressions, for example, right? So these are the types of things that you can start to reimagine. And on top of that, the multilingual feature, to be able to speak in a native tongue like Te Reo Māori and to convert that into English medical notes, also supports that type of workflow and unlocking equitable power and opening those doors and reimagining that as well.
Mm-hmm. Beautiful. So this is actually now where we come to the part of the presentation that's a little bit like how you would have experienced it if you've come to one of our evenings. And so we do want to share a little bit about how Heidi works. We like to think of it that there are 4 steps: consult, transcribe, format, and review. In real time, those actually happen almost at the same time. But I think it's quite useful to understand how an AI scribe actually works. So for us in primary care, we largely use Heidi in a consult setting, meaning that there's your patient with you, and obviously yourself. You might also have other people in the room at any one point. With a lot of specialists, they use Heidi in a slightly different way, where they often dictate after the consult. Both is possible, but if you do have the patient with you in the room, then it's vitally important to ask for patient consent, because patients do have the opportunity to say no. Not everyone is comfortable with the use of AI technology, and they do have the right to refuse. In practice, our experience is that it's probably less than 1% of patients that actually say no. But typically what a clinician will say is something along the lines of, hey, Jess, before we start today, I just want to let you know that I'm using an AI-supported note-taking tool, it allows me to just be a bit quicker around here and allows me really to focus on you during the consult. Is it okay if I use that? And everyone sort of has their own style. Some have got objectionable style, like one of the clinicians that we train in Hamilton, and he knows who he is. He's a bit of a joker, and he says, "I've got a new girlfriend, and her name is Heidi, and she does my notes for me. I bloody love her." It's a bit chauvinistic. I don't like it very much, but he had a patient who also was a joker, and so this patient brought him a red rose for Valentine's Day, so he give it to his girlfriend Heidi, which was beautiful. Anyways, you'll get your own style. You'll make up your own style for how to do patient consent, but patient consent is very important. And then I just want to share a little bit about how Heidi works. So Heidi, actually, we don't record any voice recording. That's quite important because some people are concerned that if someone gets a hold of a recording of their voice, that they can be impersonated and that it can be used for fraud. But with Heidi, that's not possible. You actually can't play back the audio. What we do is we stream audio from one of 3 apps. We've got a web browser-based app that works on any device. There's desktop application for your PC or Mac, and there are apps that you can use on your iOS or Android smartphone. Now, we encrypt all the data at rest on those devices and in transit. We stream the audio in real time to our environment, which is in Australia, in Sydney on AWS. And there's 3 things that happen inside the secure environment. Everything's inside the environment. The first step is we turn the audio into text or into a transcript. So as soon as that happens, there is no more audio file, right? It's just turned into text straight away. And then the second step is we actually de-identify that transcript. What that means is anything that looks like a full name, date of birth, NHI number, address, mobile number actually gets extracted from the transcript. And that's how we store it on the server. We've actually put it into, think of it like a digital vault with a key that we lock it up and then we replace it. So instead of, let's say, Jats Morgan French, it will be Jane Doe or something along the lines and so forth for the other patient identifiable information. And we do that so that if anyone hacks into our server, they only get the de-identified transcripts. Now, the next step, so the first step, turn it into a transcript. Second step, de-identify it. The third step is where we actually send it to the AI part of Heidi. And all that, again, lives inside our environment. It's actually set to not learn from any input. So we use multiple large language models. Large language models are there to process data and give you an output, and that's exactly what it's there for. It's there to turn the transcript into a formatted note. But we don't do that by basically training the model over time as to what you want. Instead, we use what's called the clinical knowledge team. We've got a group of humans that's made up of doctors, nurses, and allied health professionals, and they actually are the ones that curate all the different specialties within Heidi, of which there's over 200, and each one of those has got special medical dictionary. And you can imagine someone who's a podiatrist might have the same 3-letter acronym that they use, like a cardiac surgeon, but could mean something completely different. And so what the large language model does is turns the transcript into a formatted note, typically following some kind of structure like SOAP, for example, but we have got hundreds of templates that are set up to do so. And again, the reason why we don't have this AI part learn from any of the input is that we want you to be comfortable using it in with patient identified patient data, basically, and that you should know that obviously we're not using it to train a new software or sell your data. We don't do that. But we actually found that it gives you more reliable results to not have the AI learn and you having to make mistakes first and then correct them. Instead, we use all the templating and the settings from the clinical knowledge team to do that. Now, the last step, once it comes back, is we actually take those patient identifiable information out of the vault, and then we swap the placeholders back around so that in the last step, when it comes down to you, you see, okay, actually it's got the name right, it's got the date of birth right, but that's just at the very last moment. It's a little bit of a magic trick. Then the final step, which is really, really important, is a little bit counterintuitive, but the fact that Heidi gives you reasonably good to great results first time is a bad thing, because it will eventually lull you into a false sense of security, and you shall not be lulled into that false sense of security, because eventually Heidi will get it wrong, or Heidi will make some stuff up and it will get you into trouble. So you do have to always check the results and make sure that you review the results prior to you then bringing it into the source of truth, which is your practice management system, either through the copy and paste workflow, which most clinicians in New Zealand still use, about 95% of clinicians still use, but increasingly people are obviously using the integrated versions of Heidi. But yeah, okay, without further ado, I'm going to hand it over to Kalula now, who's going to show you Heidi in action.
Awesome. Well, thank you so much, Florian, for explaining how AI works. It's very important for us to understand these 4 steps, and I'll allude to this as I go through the demo today. So this is Heidi. I'm mindful that we have 59 people in this call. Some of us may have used Heidi before, some of us are super users, and some of us may have not seen it before. However, when I train these types of products, I always believe in the saying, simplicity is the ultimate sophistication. So I'm going to share with you just some of the key insights here and be able to explain it in a way where everyone can walk out understanding the fundamentals. Florian had mentioned one thing that I want to emphasize before we get into it, and that is you can access Heidi in 3 ways. Through your mobile device, whether iOS or Android, by downloading the desktop app. We recommend strongly, if you do a lot of telehealth consults, to use the desktop app because it's built for that purpose. And last but not least is the browser app. So you'll see here I'm on my Google Chrome, and I'm using this because I can zoom up for those that want me to zoom up as well. The first thing I want to share with you before we get into transcribing is, as part of us implementing, we always make sure that we emphasize the importance of setting yourselves up properly. So configuration is crucial, and I won't go into detail into that as part of today's session because I've already set myself appropriately. But for those that are interested, just note, similar to how you do a warrant of fitness on a car, this is the first thing that we typically do, especially for those clinicians that have used it before we go in and implement them from a clinic level. So on the right itself is where all the magic happens. So this is where the notes occurs, and the top right corner here is the transcribe button. But I just want to pay attention to a couple of things before we get into it. First is you can add in patient details. This helps differentiate the note itself in your sessions, which I'll share with you shortly. You'll notice here too that I have English and Te Reo Māori as my default languages. What's really great about Heidi is it just released this last week, actually early last week, where you can have up to 7 languages where it can pick it up and you can have the native tongue being spoken. I always emphasize to clinicians, it is best practice for you to only use it if you can speak the native tongue with the patient. However, we have had some clinicians come to us and say, well, what if I have a translator there? For example, a Samoan mother comes in with her son that is the translator. Well, you can use it for those purposes. And some of the use cases we've seen is clinicians will share their English presenting notes to the translator to confirm it as well. But just note that you're unlocking a language power here that also leads to equitable outcomes, which is pretty powerful with Heidi. And last but not least is, as part of this transcription, I will be applying a template. So as we've mentioned, this is where all the templates sit. And for now, we're going to be using the SOAP notes just to show you what this looks like and then share with you other templates that we've built as well. So I'm mindful not all of us here can speak because it's a webinar. So I've actually got a transcript that I'm going to be using as part of today's demo. This transcript is between a patient and a doctor. And I want you to all envision as if this was multiple voices in a room. However, I will be speaking this transcript for both just to show for demo purposes. The last thing I want to do before I go into transcribing is please make sure if you are using Heidi, check your microphone settings. Too often, we get a lot of clinicians that come to us and they spend a lot of time transcribing and then they go back and it's not generating because the microphone has not been set appropriately. If it's red, that's a big sign. If you are using headsets for telehealth consultations, just double check if it's connected to your microphone, to your headset or to the actual speaker that's supposed to pick up the noise. So that's the tip and trick based on the clinicians that were implemented throughout the past couple of months. I'm going to go ahead and press transcribe. And what Florian had said before around patient consent, you'll see here that's based on my settings, I have turned on patient consent. I want to re-emphasize one more time again that it's important for us to be able to perfect the skill set of being able to ask for verbal consent, because it only makes sense because when we copy and paste this into the medical record, it is the clinician that reviews and approves it. So like Florian has said, kia ora, my name is Kalolo, and before we get into this, I'll be using an AI tool or a digital tool to help me with transcribing my notes, just so I can be here a bit more present with you in this appointment. Is that okay with you? For those that have, that have patients that do ask more questions, we're mindful. We don't want our clinicians to sit there in a 15-minute consultation, for example, talking about mostly on data. So that's why we do provide clinician explainers, patient explainers, data and privacy FAQ, educational posters. These are the key things that we need to ensure that we implement this properly and correctly. Without further ado, I've got my transcript here at Te Whānau, and I'm going to read this of a patient that's coming in on a metformin checkup, and also just added a little bit more complexity by adding another issue around
we just lost your audio because your browser is taking your audio from the Heidi.
Oh, okay. Can you hear me now? Let me just double check that.
I can hear you.
Okay. Yeah.
Yep. Getting some thumbs up.
Awesome. Thank you. Hopefully for those that are on there, you can hear me too. So I've gone ahead and started transcribing. Good morning, John. How are you today? Good morning, doctor. I'm all right. Just here for my diabetes checkup and to get a refill on my metformin. Also, my wrist has been a bit sore recently, so I also wanted to come and check on that too. Okay, sure thing. Let's start off with your diabetes. How have your blood sugars been? Mostly okay. My reading this morning was 8.2. All right. Any symptoms like increased thirst, peeing more often, or feeling tired? A little bit more tired lately, doctor, but nothing else major. Okay, so let's examine you and just check your blood pressure and your pulse. Okay, your blood pressure is 135/85, and check your pulse, 78 beats per minute. Okay, your blood pressure's a little bit up there, John, but still acceptable. Pulse looks good. Are you still taking your metformin regularly? Yes, every single day. Any side effects? Sometimes a bit of a funny stomach, doctor, but it's manageable. All right, your sugars are slightly elevated, so we may need to tweak your diet and exercise. How's that going? To be honest, doctor, not great. It's really been stressful at work, and to be honest, I'm not exercising much. Okay, understandable. Let's aim for some small changes then. I'll renew your metformin and book an HbA1c blood test to check your longer-term sugar control, okay? Okay, sounds good. Okay, so how about your wrist? How long has that been sore for? About a couple of weeks, doctor. I think I tweaked it at work. Okay, I'll refer you to physio through ACC. I'll lodge the injury claim today, and they'll be in touch. Meanwhile, try to rest it and use ice if it gets sore. Thanks, doc. No worries, we'll review your diabetes again in a few months. Take care. Cheers, see you later. So what I've done here is I've gone ahead and stopped. Going back to what Florian said around the 4 steps is now going through a de-identification process. This typically takes 8 to 20 seconds. So once it comes out, the transcript generates into a note that is formatted based on SOAP. Okay. I'm mindful that every single one of us here, or most of us, can't respond back, but I'm going to pause for a second and just scroll down. And I want you to review this note and check out for any errors. Going back to review, it is fundamentally important for us to review our notes. Okay, type into the chat box if you're interested on maybe some of your feedback on the SOAP notes, and we'll tend to that as well. But one thing to know here is this SOAP note is a free template, and it's by default going to be sitting in all of the accounts that have been set up for our clinicians. However, one thing that I want to share with you is another template. So going back to the importance of workflows. We've had clinicians in the past maximize on template usage. In fact, I want to acknowledge some of those experts in this webinar today. I know there are a few of you here who are also template experts and know how to prompt templates. But what I want to do is share with you another template that was created called the clinician note, and it also embeds into whare tapawhā. So let me go ahead and apply that template. It'll go ahead and regenerate this note. So you'll notice with this template, compared to the SOAP note itself is always going to address based on the structure. Whereas here, this note has been specifically created to address issues first. So if multiple issues are raised up in an appointment, this will be differentiated out. When it comes to examination, you'll notice here with this template that I've applied, it also has the / in there. So for those that either use Indice or Medtech, some of us may not be using those in this core, maybe another EHR tool, but you'll see that it's actually been formatted in a way for it to automatically synchronize to measurements or to vitals based on the PMS tool that you're using. Okay, and if I scroll further down, one thing about this template is there is an embedment of te whare tapawhā, right? So you can kind of start to see the power of unlocking these things that we typically wouldn't have done in the past. So te whare tapawhā picking up physical, mental, emotional, family, and social. You'll notice that like taha wairua, spiritual, it's not mentioned there, but this template has been created in a way where if it is not mentioned, to omit this from the template. And if further down, as you can see there, there is the plan as well. So going back to the differentiation between the SOAP note and what has been built here really shows the unlocking of the power of being able to build your own workflows based on your respective practice, but also taking this further and seeing it overall from a clinic perspective. So we have a lot of organizations that we implement that tend to see workflows from a GP clinic perspective, because going back to the saying, you don't rise to your goals, you fall to the level of your systems. I also want to acknowledge those that may be practice managers, administrators that are part of this call as well. We acknowledge the importance that you have in also managing, say, a together team accounts when it comes to those types of workflows. There is two things that I want to share with you, a part of this clinical note. So just note that this is the transcript itself. This is what has been mentioned as part of the consult that I've just done. You can add in context. So for those that might want to do a bit of due diligence before an appointment, maybe add in context in the form of text, maybe wanting to attach a document or linking this to past sessions, right? So you can have retrospective sessions that you may have had with this patient. You can connect them together, although note you can only do it up to three sessions connected. And then if you go to the note itself, this is the primary note. But I want to take this further on how you can unlock other additional workflows. For example, it's quite evident in this note here that we need to create a referral letter to the physio. You could use the Ask Heidi to do anything that allows you to prompt, which is one of the new skills that I think all clinicians should be learning in this new world, how to prompt to AI. But in this instance, to make it even easier, I've gone ahead and created a template. So if I click on this black button up here, there is a template that I created called a referral letter to specialist. So what it does is it takes the primary note and then it converts it into a secondary document. So straight away it knows that we, so this referral, as you can see here, is okay, in this instance here, what I want to just share with you, firstly, before I go and show you what the actual referral letter looks like, is we've come across GPs who have said we just want the body of the referral letter, other than the before and after with yours sincerely and addressed to. Typically in your PMS tools, that's already catered to, but it's typically just the body of the letter that most clinicians typically ask us for.
Yeah, we actually learned this. We learned this on the West Coast, Jess, because we had one of the super user GPs there, and yeah, he shared this tip with us, is that the standard referral letter template in Heidi includes the salutation and the sign off, but in both specialist referrals and in HealthLink, those are part of the solution already, so they always have to remove it. But this is a hot tip. If you can create your own template that only has the main body, that can save you a bit of time. Sorry, Kalori, you carry on.
No worries. Yeah, time and time again, as we've been building templates, we get that feedback often where we say, oh, we don't need the before and after, we just need the heart of this text for our PMS. So just know that you can adjust templates according to your workflow, right? I want to go back to the note itself and just show you one of the other use cases that we've typically seen. And that is being able to use the Ask Heidi to do anything. There is a story that we typically share. In fact, I want to acknowledge someone in this room today who had this experience. And in fact, that's kind of like one of the powers of why we can use Heidi for patient facing letters. So the story goes as follows. When there was a clinician here that had a patient come in who just wasn't taking their medications. Right, from the efforts they put in, being able to follow up with them, keep them accountable, time and time again, this patient wasn't able to take their medications, for example, metformin. And what this clinician was able to do was to use Ask Heidi to do anything to write this. Explain to my patient from Aotearoa Māori worldview. And just note, te whānau, that this was a Māori wahine, right? So being able to cater this and personalizing to her, te ao Māori worldview, why they should take medication. And as you can see here, Heidi is just thinking about it, and straight away, within seconds, it's able to build a patient explainer letter. One of the key things that we often mention here, and I won't go into too much detail, but there's an art to prompting, right? In fact, there is a module that we had built alongside Collaborative Aotearoa. We built 4 modules. So the first AI modules released for healthcare, but one of those modules, called Naiako, is how to write to AI. There are 6 steps, and I recommend that you all, for those that are interested, to do this module because it'll teach you about those 6 steps. Task, context, exemplar, persona, format, and tone. If you want to know how to prompt and to write effectively in this new world of AI, understand those 6 steps, and that will get you far. So definitely recommend doing that kōrero, that module. But straight away, as you can see here, if I go ahead and press new tab, the note itself has been generated and it's been personalized as educational material for this patient. One thing that we've heard from this experience is after writing this patient explainer letter for this patient was able to start taking their medication. And this is just one snapshot of a use case of how you can unlock the power of being able to educate with your patients, but further to that, how you can create secondary documents from the primary note itself. I also want to just show maybe one other thing too we typically share is like, write me a haiku. Right, which kind of just, summarizes the note itself, balancing my health, medication in my hand, harmony within, right? So there just shows, I guess, the flexibility for you to be able to use Ask Heidi anything to pretty much generate anything based on the primary note.
Hello, can I just jump in there? Because Andy's asked a question and you might be able to ask Heidi this. Is ACC notes need to be separated from other notes? Can Heidi do this? So you've got kind of the ACC mixed in with the diabetes notes there. Could you ask Heidi to separate the notes?
Yes. Let me just go ahead and add this into a new tab first. So going back to the note itself, are you referring to this section here in the primary notes around the ACC?
Yeah, so I think he's wanting the ACC notes to be separated from, so it's kind of 2 different lots.
Just write, create a version for ACC, only the wrist pain is relevant.
Go, taking some notes there, Andy.
It's all the way you prompt, eh? You just got to understand. So let me just go add that into the new tab. And just looking at these details.
Great.
Yep. Pop into the comments what your thoughts are just by me prompting on here. But essentially what you can do, and I recommend for those that do have access to Heidi or will be using Heidi, test it out. Test it out,
Yeah.
right? Ask those questions because you will find those answers right away.
Another
Great
question
question.
that we've got there is around the mixed languages. So you talked about how you can select multiple languages. If you would have a conversation like my daughter in multiple languages, or there would, 2 or 3 different types of languages being used in that one console, can it understand that, and does it pick up on that?
Yeah, that's a really good question. In fact, we often say when the questions raised that us here in Aotearoa, we tend to remix a lot, right?
Yeah.
It's not to say like we just speak English in a consult. We tend to say like kia ora, ki te pehea koe, patai hui, right? Heidi does fantastically well when it comes to presenting notes in multiple languages. In fact, if I go here into the account section, into the preferences section, being able to speak or listen up to 3 languages, right? So you can speak multiple languages, up to 3 languages, and it'll still be able to generate it as an output in an English clinical note. Just note that
for those of you that only speak English, typically, we all recommend to select both English and te reo Māori, because your patients will probably throw in a couple of words like the ones that Kalulu just shared. So like whānau, I want to have a hui about this first, those kind of things. So definitely that's a hot tip. At least enable those 2, even if you're not able to speak
Yes.
another language.
Florian and I, since January, have implemented over 350 clinicians in primary care. And one of the things that we've learned is there are so many clinicians that speak other languages, and now everything's unlocked. I'll give you an example. Just last week, went to Otahuhu and met with, had set up Heidi with a GP. And the first consult was 2 patients coming in speaking Punjab. Right, so it's just really showed. And then I went back in right after the session, asked him, tell me how the note's been generated. Are you happy with it? And he was absolutely amazed and surprised. Although, remember, it doesn't negate the fact that we still need to make sure that we review our notes. That's why it's very important that if you do speak the native language, that you can understand what it means also in English as well. Yeah.
Beautiful.
Nice.
Kalulu, there's another question here, which is, for the hustlers of the group. There's someone on the free version of Heidi, and they are saying they can't use a SOAP note without upgrading. Are there any workarounds on this? And if so, what are they?
Yeah. Just know that if you're using the free version, you can use the default templates that are already set in the accounts themselves, and you have the ability to use the power of Heidi. However, if you want to use another templates, use the Ask Heidi anything to do anything, you only have up to 10 credits per month. So if you, for example, if I use Ask Heidi anything, that's 1 credit. So that's part of the free account. For the Pro and the Together licenses, which is the subscriptions above the free account, those 2 unlock the power of being able to use this unlimited. So just note, for those that are using the free tool, you will be able to see and embrace the power of Heidi, although just know that it is limited.
But you can use Heidi in all different modes. So you can use it on your phone, you can use it on the desktop, you can use it in the browser. There's no limitation on the free version. It's just around helping yourself with all these other workflows and some of the fancy magic trick that Kalulu has provided you. That they are a paid feature. Certainly the multi-language feature, though, that's also in the free version. So you can use it in te reo and English. That's all in the free version.
Yeah, all in the free version. There's one last thing I want to share with you guys at Tefano. So just notes that as part of, for those that are using the Together license, you have the ability for Indice right now to integrate Heidi into Indice. Some of us may have seen a Heidi kind of button in Indice for those that are Indice users. And MedTech will be coming out very shortly. So in regards to the integration. But the reason why I bring this up is consider Heidi as a work in progress / drafting tool. Right, so I often say, and I see a lot of clinicians do this, but I think that's not best practice, is they copy the note as draft and then go make the edits in the medical record. just know that I strongly recommend that you use this as your reviewing and your place where you make the adjustments and draft. So there are 3 ways to edit, right? You can go into the note itself and you can type it out, right? You also have the ability to use the dictate function, right? So as I turn this on, and if you don't have time and you want it to just voice out, you can do that. So as you can see, it's picking that up. And last but not least is you can use the resume function at the top to make adjustments. However, be careful, because for those that use it and you review your note and you're happy with the note itself, and then you resume, just note that it regenerates the whole note, right? So I'll just quickly show you what that looks like. So instead of it maybe being blood pressure 135/85, I can say blood pressure was actually 140/90. What it does is it regenerates the note itself. It goes still through the identified process because it captures in the additional resume parts of the transcript, and then it regenerates the note. But I just want to quickly show you what that looks like once it's generated. And as you can see there, it's made the adjustment, but just be mindful for those that are using it, it will regenerate the whole note. Once you're happy with the note itself and you've made those adjustments and draft accordingly, recommendation is to click on the copy button up here, go into your practice management system, and then paste it into the medical record. Okay.
Are you showing a secret new feature there, Kalolo, about
Yes.
the task?
Yes, this task is in beta phase. It did get released 2.5 weeks ago, but as you can see here, it's starting to action based on the primary note. So lodge ACC claim, refer patient to physio through ACC, and renew metformin prescription, right?
Yeah. We also didn't have time for that today, but we've also just recently released our coding feature. So Heidi can now code in SNOMED and ICD, which is pretty amazing. We are actually really interested in getting some feedback on that and getting some early users. And I know that we're working with some PHOs who are really interested in that. In the hospital space, a lot of the coding's not happening by the clinician. It's actually a coding team that does that. So we're just working through how we can route that to the other roles that we have. And I know that Kalula didn't talk about this, but for specialists, there are other roles, but clinicians that you can use Heidi with, such as assistant administrators that can actually do a bit of work for you. Not a typical GP workflow, but those that have got secretarial support, that is something where your secretarial support, your typing support can set up sessions for you on your behalf and also do the final paste and modification and formatting in the specialist PME system, typical workflow. That's what Kalula was just showing off there.
Yeah. This is just to show you, for those that are interested in the Together account, you have the ability as an administrator to make changes in. I stem off what Jess has worked hard on with Collaborative Aotearoa on privacy impact assessment. I know that's probably a big topic of mind for a lot of us here in this call, but the privacy impact assessment is just to ensure that we're tika and pono on this tool before we implement it correctly, right? But part of privacy impact assessment in action is to be able to have the ability to configure at a team level multiple things, being able to add extra layer of security for MFA, being able to turn on for every single clinician in your team patient consents. You can control that on this side, and then also being able to automatically delete past sessions. Like I've mentioned before, Heidi is a drafting tool. It should not be the source of truth that is the medical record and the PMS, but you have the ability to delete from our servers and from your Heidi account as well over a period of time. So if I did a consult today and I set this on for 90 days, within 90 days, that note will be completely deleted from Heidi and also from the Heidi servers. So you have the ability to do that from a practice level. Yeah. Cool.
I just want to reiterate the 90 days is something that came up in our PIA that we did do. And if you haven't already set your deletion to 90 days, that should be the one task that you do following this meeting. It is something that we've deemed as being quite critical and quite important in terms of patient data kind of sovereignty. So a really easy thing to do, and just kind of logging in like Kalula just showed you, being able to change those.
However, for those practice managers that have got users on the free or the pro version, it's something that you have to have a chat with each individual doctor because they need to set it themselves. So you can still do it, but it's you can't do it as easily as Kalula's just shown you.
Great. We've got a few more questions, Kalolo, and then I just want to kind of wrap up with a few kind of tips around how you might implement this safely into your practice. But Neil's talked a little bit in his question about a education planning meeting that they have with some of the whānau. He's working at a large special education school. They're usually around 1 hour kind of long meetings with each family member in the school. The meetings are a time for the team to discuss the children's goals, both educational and therapy related, and do discuss and disclose a lot of confidential information in those meetings. It's really important to capture the information that is shared, which is a very daunting task. And if anyone's ever taken minutes in their life, they're empathizing with Neil right now. Would Heidi be a good tool to support this process for a therapist working in a large special education school?
Yes, I mean, to answer directly, I think any kind of mahi that you do that requires a lot of documentation, and in this instance, I do see a lot of that, right? In fact, I know straight away, if you're doing an hour session, it has to be detailed. There's a lot of documentation. So to answer your question directly, yes, you can use Heidi for those purposes. In fact, we've had we've worked with multiple organizations, particularly mental health, those in the mental health sectors, our social worker whānau. For those that are social workers here, I acknowledge you. I've had multiple kind of situations and questions around, sensitivity of information that's been raised up. How is Heidi going to capture this, and how do I also give comfort to the person? Because remember, from a verbal perspective, asking for consent before you use this, before they're even vulnerable, is important, right? But one thing's for certain is you do have the ability, based on your template workflows. That's why I go back to templates. It's very important. For example, if you provide me an example of what that template should look like, for example, a de-identified maybe notes that you've done in the past that you think is like your quintessential example, give that to us and we can build that as a template, and it should be able to be done. But however, it's important to review your notes, but also firstly ask for patient consent. And I've just come back from Dunedin last week teaching social workers on making sure that they do that, because they look after rangatahi, those that are going through mental health struggles that are rangatahi.
Great.
Maybe Jess, this would be a good idea for a follow-on session. Maybe we could do like a template building masterclass or something like that, where we can, because we can build it for you, absolutely. Yeah. But it's actually not so difficult. We actually had a nurse leader in a hospice build a template for her school parent-teacher meeting workflows and recording those. So she built it herself. And you can too. It's not rocket science. We're running out of time today to show you the ins and outs of that.
Yeah, I think that's a great idea, and we've had a few thumbs up in terms of that idea, so we'll definitely follow that one up. I think for those that are healthcare home practices, you've been working on your model of care for a while, we often will huddle in the morning. We'll do little kind of team briefing, standing huddles to kind of debrief on the day and go through that space. So being able to use a tool like Heidi to capture that, you've got your mobile phone there, quickly turn it on, then you can send that out to everyone in the team. I know my team, we have a huddle on a Monday, and no one likes to have a Monday off because they don't want to miss the huddle. So it's like a really good way of being able to include everyone, even if they're not there with us. Andy, I think, asked a really interesting question, which is, how do I know that Heidi's Māori worldview perspective is actually appropriate? And I think it's an interesting question. It's probably a far too big a question to ask at this late in our webinar, but do you just have some kind of high level, I guess, reassurance or confidence for Andy around how Heidi's pulling that information through?
Yeah, that's a big question, and it's a very valid question as well. To be able to validate what has been provided, right? And in this case, from a Te Ao Māori worldview. I also respect that there are different nuances depending on which part of the motu you're from when it comes from like understanding what your worldview is to the world. It all goes back to being able to build templates based on that. and also being able to prompt effectively. I'm mindful that there are two big issues to AI. The first one is hallucinations, right? It can provide inaccurate results. That's why we emphasize review your notes. Critical thinking skills is one of the most important skills in this new world for every clinician, I think for everyone in general. But secondly is bias. Well, AI is only as good as the data that is given to them. So that's one of the things that we are mindful of. It may not be representative of marginalized communities. So we're currently actively working right now with Health Hawke's Bay around what that looks like around data sovereignty and also for Māori from a Te Tiriti o Waitangi principles from the health and disability framework that we're working on right now as well. So these are some of the big sensitive points that we will be raising with Heidi along the way, if that makes sense. Yeah, but for now, my suggestion is give it a try. From a reviewing perspective, there are three things to be mindful of when you review notes: is it clear? Is it correct? And is it clinically safe? Those are the three C's. But yeah, from a Te Ao Māori worldview right now, I can't give you like a direct answer of whether it is accurate, but it's a matter of us making sure that we review our notes.
But we are obviously working with a lot of Maori organisations. We encourage them to review it, and so far we have not gotten many glaring issues, except for what Kalora talked about, which is that there are different iwi across the country, and they have got different views on things, and it doesn't give you that differentiation, and we're not able to, for example, when we translate to te reo, we can't make it so that it spells it the northern way versus maybe somewhere down in the South Island how you would spell certain Māori words. So there are limitations that are definitely still in the version of Heidi now.
Great, thanks team. It's been an absolute pleasure to kind of walk with you and talk with you over the last hour. I think just for our listeners that are still there, if you are deploying any AI tool in your general practice, it is really important that you do some due diligence on that tool first. So those are things around understanding where is the data going, what is it being used for, where is it being stored, how is it being used to retrain the model, etc. So those are things that would come up in a privacy impact assessment, or what our AI primary care working group is calling an AI assessment tool. So actually we don't just look at the privacy elements of an AI tool, we also want to be looking at the data sovereignty elements. We want to be looking at the appropriations for them in a New Zealand and Aotearoa context, but also within our kind of health system context. So Collaborative Aotearoa has created an AI assessment tool for you. It is on our website, which you can all download, regardless of who you are, members or non-members. And that assessment tool is there to help guide you through a PIA. It is quite a big task, and I wouldn't expect most people working in general practice in New Zealand to be able to do this by themselves. So it is something that you might want to ask for help with, or kind of reach out and see if you can get some support to get these tools done. So we have at Collaborative Aotearoa done a PIA or an AI assessment on both Heidi and Nabla as AI scribes that are commonly used in Aotearoa. And we are confident in both Heidi and Nabla as appropriate tools to be using in New Zealand. The Heidi tool did come back a lot more culturally appropriate for Aotearoa, which is why we've leant into the team at Hendrix and Heidi and have been really promoting their work and their tool. So a few things: make sure you do your due diligence on any tool. A whole lot of them are coming out, and they're coming in hot and heavy, and I think it's really important that we take a moment to go, is this appropriate? Have I thought about where all the information is going? The next thing I really kind of want to stress, and Kalora has mentioned it today, but it is consent, 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 consent. If you are not consenting your patients, then you need to start consenting your patients as they come in. So adding the little prompt to make sure that you are consenting or having some processes in place. You can have signs in your waiting rooms. Your receptionist can do consenting. There's multiple ways that you can consent a patient as you come through, so that when they do get to your consult room, it is quite a swift process. But thinking about that and making sure that you've got a process in place will really help you as you go through. So those are kind of my key tips in terms of making sure you're getting them out. The other thing is, with all these AI tools coming in hot and heavy, if your practice doesn't already have an AI policy, it needs to think about having one, and it needs to think about what that might have in it, and also how that links into your clinical governance, especially when we start to think about the power of some of our tools in terms of clinical decision making and supporting us in that realm. So if you haven't got an AI policy for your practice, again, the CoLab has got a template for you on our website, which you can go and download. But if it is something that you're needing a little bit of help with, please reach out to the team at the CoLab, and we'd be more than happy to support you to get that resource up and running. And if you haven't done our modules on our learning management system, please log in and do them. Kalula's done a beautiful job of making sure the content is on point for you. But the biggest thing with AI is you guys are all here because you're curious and you've got some kind of awareness and you're kind of wanting to learn a little bit more. But we need to make sure that all the people across our general practices are getting that knowledge and that awareness of these tools, and that we're really educating the sector on that. And there seems to be very little of that going on out there. So if you can all, from the session we've given you tonight, we've given you our love, we've given you our knowledge, we've given you our information. I guess our challenge or our call to action for all of you is to go and share this with another colleague. So we've got 48 people still on the call. If you go and share to another 48 people, then we're going to start to really educate our system and our sector on how to use these tools in a really clinically safe and appropriate way. If you've got any more questions, feel free to dump them in the chat, and we will try and answer them for you as we're wrapping up. This webinar is being recorded and it will be available on our YouTube channel within the next 48 hours. And we really thank you for coming along. Thank you, Flo. Thank you, Kalolo. You guys are absolute legends. We love working with you here at the CoLab. And we look forward to round 2 on how to build a template. But to close this out, I'm going to close this out with karakia. Have a beautiful Monday evening. I'm really desperate to know who's winning the netball. So I'm going to go and watch that on replay. Nobody texts me any scores. Te karakia to close us out. Ko te pū, te more, te whū, te aka, te rea, te wainui, te kone, te whē, te kore, te pō, ki ngā tangata Māori, ngā rangi rawa ko papa, ko tēnei te timatanga o te ao. Ka ki te koutou. Have a beautiful evening.